Good afternoon, everyone, and hello. I'm Margarita Birnbaum, and I am the health equity healthbeat leader for the AHCJ. And this webinar is one in a series of topic-specific training opportunities to brief health journalists on the latest information in a particular health area and to give you story ideas or story resources you can use in your work. Today's topic is immigrant health, and I thought it'd be a good idea to have a webinar about this because it's not a subject that's covered frequently in the news. The stories don't always have the context that they need. And as you will learn, there's not a lot of data out there on immigrant health and trends or issues that affect access to care for immigrants, which are very specific and also unique. Our panelists are going to give you information about that. We have a researcher from KFF. We have a reporter with KERA News, the NPR station in Dallas, and a social services manager from Florida, but I will actually introduce them formally now. So joining us today are Drishti Pillai, and she is the investigator with Kaiser, and she is the lead on a recent project that Kaiser has on immigrants, on immigrant health and specifically, and there are a few reports that have been published already. And she's the director of immigrant health policy at KFF, and she oversees data and policy analysis about healthcare access trends and issues in immigrants in the US with a focus on health equity. And before that, Dr. Pillai was the research director at the National Asian Pacific American Women's Forum and a faculty member at George Washington University. Adriana Menendez is the social services manager at the Rural Women's Health Project in Gainesville, Florida. And in that capacity, she manages the day-to-day operations of Project Salud, a referral line catering to the needs of the Spanish-speaking community in Gainesville. In her capacity, she also collaborates with healthcare providers, legal experts, and social service agencies to expand the network of available resources for callers. And she is an advocate for language access for minorities and emphasizes the importance of inclusivity and cultural sensitivity in healthcare services. And Stella hasn't joined us quite yet, but she covers immigration for KRA, the NPR member station in Dallas. In 2019, she broke a national story about a large-scale immigration raid on a tech repair company in Allen, Texas. She's reported on the Uvalde school shooting. And the mass shooting in El Paso at a Walmart there. And although she hasn't specifically covered the immigrant health beat, she has been covering immigration for a while in the different beats that she's had, and she's interviewed immigrants from all over the world in the reporting that she's done. So she has some reporting tips about, interviewing foreign-born people who live in the U.S. And we will start with Drishti, if you could. Drishti, why is it important to study immigrant health? And, tell us about the project that you worked on or are working on with the journalists at the LA Times and how that came about.
Yeah, so immigrants, are a diverse and growing population in the U.S., and they play a significant role in the country's workforce and communities. In fact, 1 in 4 children in the U.S. has at least one immigrant parent. And even though immigrants include individuals with varied citizenship and immigration statuses, countries of origin, racial and ethnic identities, and social and economic circumstances, this diversity is not always reflected in policy debates and discussions. So, a deeper and more nuanced understanding of the health and healthcare experiences of immigrants including the challenges and the barriers they face in accessing care, is increasingly important in order to make sure the community's voices are included in policy discussions as well as decisions around resource allocation, especially at a time when there is a strong anti-immigrant rhetoric. And this is sort of how KFF's project came about. We partnered with the LA Times on this project, which I can speak to more just in a bit. This is the largest nationally representative survey focused on immigrants conducted to date in the US. We had a sample size of about 3,500 immigrants. It's nationally representative. We conducted the survey in 10 languages across 3 different modes: phone, online, paper, to make sure that we could reach as many immigrants as possible.
So how did you partner with the LA Times? Can you tell us how that came about and whose idea was it? And had you ever worked with journalists on a research project before this one?
I know that KFF has partnered with journalists on some smaller survey projects before, but not one focused on immigrants. This project was in discussion for the last couple of years. We felt that, partnering with a journalistic organization in this project, so in this case the LA Times, would allow us to combine the data and research expertise that KFF has with the powerful reporting and storytelling ability that LA Times has. The KFF research expertise enabled us to conduct this nationally representative large survey, which involved a very challenging and extremely complex sampling and fielding process. And through this survey, we were able to gain a rich and nuanced understanding of the US immigrant experience by many factors, including race and ethnicity, immigration status, income, limited English proficiency status. And then the LA Times' reporting really helped to bring these numbers to life by telling the personal stories that lie behind the data. The LA Times also used the survey reporting to help educate readers about immigration laws and policies where the survey identified there was significant confusion among immigrants. So the LA Times' stories provided cautions to help immigrants avoid scams. And in addition to that, the LA Times also included in their digital package an interactive quiz that readers could engage with. They included, compelling photos and graphics, and so it was a really successful partnership of bringing data to life with storytelling. And both organizations worked in partnership throughout the development and implementation process, with LA Times reporters being engaged in the development of the survey. Several of them also joined us when we conducted focus groups across some states in the country with immigrants to help inform the development of the survey. So we had LA Times journalists attending some of those focus groups. And KFF was also able to support the journalists at LA Times by not only providing the data, but also identifying survey respondents that were willing to speak with journalists in one-on-one interviews.
Before I ask my next question, I'm going to remind everyone to please put your questions in the Q&A feature and not the chat, and I'll be looking at that throughout the webinar to ask your questions. Drishti, I noticed that one of the things that the reports are going to offer and that you looked at is the diversity of immigrants in the country. In other words, that you also asked people about, where they were born, and their educational background, their employment background, their income level, and I want to know, why was that important for you, for your team, is what I mean. And before you answer that question, I want to welcome Stella to the conversation. Thank you for joining us, Stella. And I'm glad the tech issues are resolved.
I
So
apologize. I apologize to everyone. I just could not get it to open on my computer. So sorry about that.
Well, and then I'll reintroduce you. This is Stella Chavez. She covers immigration for the KRA, the NPR station in Dallas. So now I will let you answer, Drishti. Why was it important for you all to look at the, diversity of immigrants in terms of the background?
Yeah, so the immigrant community is not a monolith, but a lot of the existing data out there and a lot of the stories on immigrants sometimes present them as such. Immigrants are a very diverse community. Like I mentioned, immigrants come from hundreds of different countries, represent so many different languages spoken. Immigrants also come to the US for a variety of different reasons, and push versus pull factors. There are immigrants that come to the US seeking better opportunities, better job opportunities for themselves, better educational opportunities for their children. There are also immigrants that come because of push factors, because they are trying to leave poor working or economic conditions in their own countries, or trying to leave sometimes unsafe and violent conditions in their home countries. So understanding some of these migration pathways, the reasons that immigrants come to the US, as well as their demographic, social, and economic backgrounds, really helps understand why, helps provide context to the experiences of immigrants, and helps highlight why some groups of immigrants, for example, in our survey, we found that Black and Hispanic immigrants, as well as immigrants with limited English proficiency or LEP, face significantly greater challenges sort of consistently, whether it's in healthcare, in their workplaces, or in their communities. So in order to really highlight this diversity and understand the nuanced experiences of immigrants, we thought it was really important to collect data on as many of these factors as possible: where immigrants were born, when they came to the US, their English proficiency, socioeconomic status, and as well as other things.
Why is it that there isn't as much data out there about immigrant health, or the health of immigrants in the US?
So generally, federal surveys in the US, they do not provide deeper insights into the healthcare experiences of immigrants, particularly on topics such as, having a trusted healthcare provider, experiences with lack of culturally competent care, which Adriana mentioned briefly, or experiences with discrimination in healthcare settings. We don't have that data from federal surveys. In addition to that, federal surveys are limited in that they cannot, federal surveys usually do not collect data on immigration status. It's also something that immigrants may be hesitant to report in surveys from the government. So it makes it really hard to uh, learn about the experiences of immigrants by these factors, because federal surveys just do not allow us to collect that information. Yeah.
Could you highlight some of the findings that surprised you, if there were any?
So as someone who studies immigrant health, I don't think there were any survey findings that were surprising. However, I do think that some of our survey findings just provided a much fuller picture of what it means to be an immigrant in the US today than is typically portrayed in debates and discussions. And some of the major themes that really stood out, maybe not surprising, but still stood out, were the resilience and optimism of immigrants in the US today. Many come to the US for better economic and job opportunities, for a better future for their children. And despite facing substantial challenges, most immigrants remain optimistic and feel that they are better off as a result of coming, which, the LA Times journalists, I think in one of their stories, they talked about how this is such a uniquely American trait, the feeling of optimism and of believing in the American dream. And in our survey, we found that immigrants very strongly believe in these, even though they face substantial challenges. And some of those challenges that they face include not only challenges making ends meet, but also unfair treatment and harassment in their workplaces and communities, as well as we found that there were major challenges for immigrants in trying to access healthcare, especially due to there being pretty high uninsured rates among immigrants. And another finding that stood out was, I think I mentioned this briefly, but some groups of immigrants consistently report worse outcomes and greater challenges, such as Black immigrants, Hispanic immigrants, immigrants who are uninsured or undocumented, immigrants with LEP, kind of highlighting, the intersectional effect that race as well as immigration status can have on a person's experience in the US. And another finding I think that really stood out was the substantial confusion and lack of information around immigration laws and policies and how those can impact immigrants. There was also a lot of fear and avoidance in trying to access assistance programs that immigrants themselves could be entitled to, or their children could be entitled to. So yeah, those were some findings that really stood out to us.
Some of that data on states was very timely, or is very timely, given the Medicaid unwinding and just kind of shedding light on what may be available for immigrants, authorized and unauthorized, right? And what they're eligible for, due to their immigration status. I'm going to turn this over to Stella now. I'm going to uh, ask you my first question, Stella, is how is interviewing immigrants, whether they're unauthorized or authorized, different and similar to interviewing somebody who is U.S. Born? I know that you've started covering immigration as a beat relatively recently, but you've been interviewing immigrants from all over the world in your capacity as a reporter for a long time.
Yeah, that's right. Yeah, so typically, if I am interviewing or if I plan to interview someone who is, say, in the country unauthorized, or perhaps I don't know, or they haven't shared that with me, the very first thing or what's important for me is to make sure that they understand that this if I'm writing a story or if it's a story that's going to be published both online and air on the radio, that they know what that means, that anyone could hear it, anyone could read it. Are they okay with that? And if they're not, I'm not going to pursue the interview, or we may agree, she or he and I may agree to just talk, on background or off the record, I should say. I think those conversations are really important too, even if you're, as a reporter, not able to use that information in a story. Their story, their experience may still be helpful in, whatever it is that you're researching or writing about. So I think just there's some sort of, uh, I think with any interview that you plan to do in an immigrant community, you just have to be very upfront about what is the purpose of the story, where is it going to be published, where is it going to be seen, are they okay with that? And sometimes they are. I mean, sometimes they want to share their experience, and they're hopeful that maybe by sharing their experience, that will help someone else in a similar situation. So as you pointed out, I've been doing this for a long time. I'm only recently officially been covering immigration, but my very first job in Central Florida, which you worked there also, Margarita, the Ledger in Lakeland, Florida. My job was mainly to cover, small town government, go to city hall, cover city council meetings. But I spent a significant amount of time in the migrant farm worker community and ended up doing a number of stories on that community. And at the time, I may have been maybe the only reporter doing most of that. I mean, it was this kind of a area in between Orlando and Tampa. And so there wasn't a ton of news coverage there. So I think if it's not something, if immigration or covering immigrant health is not necessarily a beat that someone has, there are still ways to cover that community. And I think the more you spend time in those communities, you gain the trust of people there, and also sources. I can't stress enough how important it is to build that relationship with sources, the people who work in those communities, who work with immigrants, who know them, who spend more time there than perhaps journalists. So those are, hopefully that answers your question.
So, what do you do to, build on that trust after you write a story, right? Because it's so easy, I think, sometimes just to kind of parachute into their lives, and that's true for any source, right? But what are some of the things that you do so that you keep building on that trust even after the story runs? Do you take people out to lunch sometimes, or do you just call them every now and then, meet them for coffee? Could you talk a little bit about that?
Sure. Um, I think that one of the first things I do, or what's important for me, is to let them know if the story aired or when it was published. I always try to get, it's important to get their contact information when you interview them, whether it's a cell phone or email or both. And I try to let them know, if I know ahead of time when the story is going to be published, when it's going to air. If I'm not able to do that before, certainly afterward, I send them the link. And I also try to follow up. You know, I'm guilty of, I think a lot of us get busy and then we don't follow up, but um, whenever I can, I do try to check in with them to see, how did the story turn out, or do they have somebody who can translate it for them? Because it could be, my stories appear in English and air in English, so they may not completely understand, but is there somebody in their family or somebody in the community who can help translate for them, or interpret the story? um, and I think it's hard because sometimes you do, as a journalist, you move on to the next story, and you don't always have the luxury of like continuing to go back to that person, um, or continuing to cover a certain issue. Sometimes whatever is happening, the news of the day sometimes dictates what you end up doing. But in general, it helps, going back to the relationship with sources, and by that I mean the people I interview obviously are sources, but the people who work in the community, who work for various organizations, they are so key because they are the ones continually going back to those communities. And they are the ones I often check in with pretty regularly. How is so and so doing? What is the latest? And so there've been a number of times where I've gone back, maybe a year later, and done an update on there's a family I'm thinking of. I guess it may be now a couple of years, that a woman from Afghanistan came to Texas, and sadly was separated. This is when the US military pulled out of Afghanistan, and she was able to come, get on the plane to come here, but she left behind her children and her husband and her mother. And that was difficult for her. And so I've been trying to check in regularly, and it's hard to connect with her, one, because of the language barrier. um Two, she's not always going to pick up her phone. um but I try to check in with the person who initially connected me to her, and just, how's it going? Do you think that she would be open to an interview, an update interview? What's the situation with her husband? Is he able to come here? Those sort of things. And then lastly, I'd say attorneys, uh, people who work, who are representing the families, have been extremely helpful to me. And um, again, like, sometimes you're not able to stay in constant contact with the person you're interviewing, but you try, and at least through these other people that have connected you to them.
So, in preparing for the panel, you and I, talked briefly about, when we met with Drishti. How do you share information about your source, who is an immigrant, without their immigration status being the only thing that identifies them in a story. Like how do you handle that to let readers know, this person may be from another country, whether it's Afghanistan or Mexico uh, or, Senegal, but, these are their needs and wants and hobbies and tastes in music, things like that.
Yeah, I mean, it really just boils down to asking a lot of questions, asking what their interests are, what do they want to do? I mean, most people who come here, I mean, I would say everyone who comes here to the US comes with an idea or a dream, even if it's just to work. They likely have, if they have children, they want their children to go to college. They want their children to, become doctors or nurses or, teachers, whatever it is. And so I really try to, when I can, and if if this is not like some quick hit story, I really try to get into, what is life like for them at home. When do they go to work? How much do they work? I mean, I think it's also important. It's one thing to say, so and so is working, 2 jobs or however many jobs they're doing, but are they working the graveyard shift? Are they, I think it's so important to, as much detail as you can provide in a story to show, the sacrifices that people are making for themselves, for their families. There's a story I did, this was probably now a couple years ago, I worked on with another reporter at the Dallas Morning News, Diane Solis, and we wrote about a young man from Honduras who had come here. This was during a time a lot of young boys, children were coming to Texas or to the US. And he was part of a group that had been placed in a shelter or temporary shelter in Dallas. And so this was just like a stopping point for him. And he in this facility in Dallas, we had learned through sources that he enjoyed playing the guitar and also enjoyed singing. And so when Diane, my colleague, and I eventually met with him, and we met with him via WhatsApp, we weren't able to actually meet with him in person. We asked him about that. So, we understand you enjoy playing the guitar, or, you enjoy singing. Who's your favorite musician? And we asked him to, share some of that with us. And so he, during his free time, went outside with his guitar, set up his phone, his cell phone, so he could record himself playing and singing. And it was just a nice, detail in the story. And because my story, it published and it was in print, but also aired on the radio, you could hear his voice, you hear the music, and I think anyone, I mean, you'd have to be heartless not to appreciate that, here's somebody, I mean, they're not just the undocumented immigrant. They're not just, a number. I mean, they're really a person, and they're really no different than any of us.
Well, next, I'll start asking Adriana questions. Adriana, could you please share with us, what is it that you do? A little bit of what you do and your experiences have been with the Rural Women's Health Project, and your experiences in being interviewed and with the media. So a two-parter question, I guess, there.
Thank you. And believe me, I was hearing things from Dr. Pillai and also from Stella, and I was like, that's totally true. That's exactly why things are happening. That's exactly how you need to do this. So at the Rural Women's Health Project, I am the social service manager. Rural Women's Health Project is a health and social justice nonprofit in pro of the immigrant community. But I will say that Rural Women's Health Project is probably, as other organizations know us, but the community itself, the immigrant community, knows us as Project Salud. And in Project Salud, we have a community health workers. We have a referral line. A colleague of mine, Alejandra, and myself, we are the people who are always answering the phone. And like that is how we get to know a lot of people, a lot of the community. Estella was mentioning something very important. I'm sorry that I'm jumping into this, but I don't want to forget. Because of the work that we do at the Rural Women's Health Project in the North Central Florida area, we are one of the 2 organizations who is doing this type of work in front of the immigrant community. So usually reporters tend to call us to interview us, but also to ask you for resources, to talk directly with the community. So it's very important to have that follow-up, to have that good communication and that connection with the person that is providing you the very value and confidential information of people that you probably can interview tomorrow or some other time. It's very important to have that follow-up with the person that you are interviewing, but also with the person that is giving you that important contact. In the case of us, all the contacts that we have, all the people that have called us, all the people that we have met and that we have their basic information, it have been years and years of building trust. And that's why they are open to give us that information. And by having long conversations with them, is that we find out what is their country they are coming from, how they came to the United States, what is their background, if they are here in maybe in an asylum process, or they are undocumented and with no chance to get legal status in the country. So we as an organization, when we provide the information of somebody that a reporter can interview, that person is 100% trusting me, that I am trusting this reporter, that this reporter is gonna ask the right questions, that is not gonna take pictures if they don't feel comfortable with their face being exposed to the world. So all those details are very important. And it's important to know that the people that you are interviewing, doesn't matter if they are undocumented or not, they are a person. So make them feel a person. Don't make them feel just used. Which I think that's something that it tends to happen a lot. I have seen it and I have experienced it myself. These interviews tend to be so quickly, so rushed, and it's like, okay, bye. So then you just feel like, okay, just what happened? If you are gonna expose the name of somebody, make sure to tell them, to ask them, it's okay if I write your full name in an article. It's okay if I post your country of origin. There is very important things. I remember the case of one of our contacts. She was a recent arrival, but the time she was interviewed, she didn't have a status at the moment, and she was not in the process of one either. And there was this big article about the story of herself and her family, and there was picture after picture after picture. Because at the moment she was an unauthorized immigrant, I know that if you would ask her, she wouldn't be okay with being so exposed. Full name, cannot even mention the neighborhood where she was living. And it's important to mention that we live in Florida, and we live in the north part of Florida. This is a very conservative area, and immigrants are not very are not very welcome. So when you expose somebody as an undocumented, as immigrant, and you expose the face of that person, you don't know if tomorrow the neighbor could see that that article in our website, that article in television, and see like, oh, that's one of those people, and start to being discriminatory against that person.
So you, because of the work that you do, you have a sense of, healthcare access issues that are unique to immigrants, where they're undocumented or authorized. What are some stories that you think reporters should, look at, should be writing about, themes that they should be including in stories about healthcare access and the health of immigrants?
I will start with the fact of it doesn't matter what is the status of a person, of an immigrant person. If that person is working, let's put the case, okay? Let's put the case of somebody who is undocumented. That person is working because everybody has to work in order to have income to pay for your rent, for your food, for transportation, for clothes, entertainment, etc., right? Something that usually reporters don't take in account is that this person, doesn't matter what is their status in the country, they are bringing a good things to the country. It's because of these people that we are able to have fruits and vegetables in the supermarket, in our tables, and that side, it tends to not be in count. I feel that as immigrants, we tend to be one of two things. We are the ugly, we are the not wanted, we are criminals. That's one. Or the other, we tend to be seen as the victim. Oh, the poor immigrant that needs so much help. Oh, poor person. But undocumented or not, immigrants comes from all different backgrounds, and it could be somebody with very high education that is coming to the country for getting even more education, or it could be somebody also that is coming from a very poor area with a lot of bigger needs. So I think the spectrum, it tends to be seen just through a filter instead of the person in general, the people, just like Estela was saying. We are just like you, and we want the same things just like anybody else.
So Stella, you worked a few years ago on a project about heat-related deaths in Texas, and it was in the construction industry in particular, if I recall, right? And there are a lot of construction workers in Texas, and in this area certainly are immigrants. What kind of health reporting did you do for that, if you did? And what are some of health related angles that you've come across in your reporting, or that you would like to pursue, if any? I know your beat's pretty broad.
Yeah. So the heat worker death series that I worked on was a collaboration with another reporter at another Texas public radio station, NPR, and several other organizations. And so most of my job consisted of, or work on that project was to try to find people to interview. And we had help from people who are much more, who are good at, or experts at working with data. And so we didn't just look at like the construction worker or construction industry, but rather, the number of people who had been affected by a heat-related illness or had succumbed to that, had died. We looked at the demographic breakdown of that. And so some of the other reporters working on this, we kind of all, how do I put it? One of the other reporters was able to track down some individuals that I could then go out and interview. And so, but before any of that, we met regularly to go over some of the information that we were learning, some of the data, and also making sure that some of the people we talk to are people who are experts at, worker safety. What are companies required to do for individuals or for their employees? Are they required to provide mandatory breaks? In the case of these workers who died, who we featured in this series, what was the situation there? What was the company doing? The fact that, and don't quote me on this, but I believe if your internal body temperature reaches, I think it's 177 degrees or something, like it doesn't even register above that. And, they most likely will have died if it's gone, if the temperature has gone up that much inside their body. So even though, health reporting isn't necessarily my background, there were some basic things that we kind of had to learn about, going into this, or while we were working on this project. As far as, and then I'll just add that the talking to the family members of, these workers who died was extremely difficult, because they were still processing, they were still grieving. And in one case, the parents or the father refused to talk. I mean, initially had said through his attorney that he would be willing to talk with me, and in the end, he just didn't return any of my messages. And so, I'll say that sometimes, even if initially someone agrees to an interview, there's always a chance that they could change their mind. I mean, and this is true with anyone you set up an interview with. And so, as a reporter, you just have to respect that. I mean, you can keep trying, but there comes a point where you just have to respect that they're not up for that, and that's okay. As far as like health related stories that I would want to do, I mean, I think one thing that hits really home for me is, children who are, and I say this because this happened to me, who end up becoming, children of immigrants or immigrant children, who end up becoming the caregiver of, their parents, and the toll that takes on an individual. I mean, there've been a number of stories, series about, caregiving in general, the role reversal that happens. But I think that there is a unique experience with when you are, the child of immigrants, and your parents maybe aren't, their English is not great. The medical jargon is confusing. I mean, it's confusing for any of us, even if we grew up here, even if we studied here. And that's it's stressful, because you want to make sure that your parent, if you're taking them regularly to the doctor, do you understand what is happening to your parent? How do you explain that to your parent? Juggling that, caregiving with, a full-time job. So I think that those are, there's the health, is in terms of health, there's whatever illness it is that your parent is dealing with, or maybe there are several different illnesses. And then there's the mental health aspect of it too, and the toll that it takes on your mental health, both on, you as the caregiver, but even the parent. So, in my case, my father had a stroke. He was the primary, breadwinner in the family. after he had a stroke, he could no longer drive. He wasn't, able to, handle the financial aspects of the household. So that became the responsibility of myself and my brother. A few years later, after my father died, and then it was just my mother, and then her health started to decline. And so, that I think that's something that maybe hasn't been explored as much. And so I would at some point love to dive into that issue.
Well, thanks for sharing that. That I actually hadn't thought about that, so I'm glad you brought it up. Drishti, what were some things that you learned about, the way journalists work in working so closely with journalists at the LA Times? It's like you got a behind the scenes look at what goes on, and if you could talk to us about that, what was that experience like?
Yeah, it was really interesting, very different from, I come from a research background, so always focused on the data and some of the things that Stella and Adriana hit on, which are just the people behind the numbers. So when the LA Times would join us in focus groups, just looking at their method of engaging, noting down the stories of the participants and even how they reported on some of the survey respondents, it included all these, not just what makes the immigrant experience different, but what also makes us all similar. They did stories where they talked about immigrants who work multiple jobs and what that's like. And, one family was really proud that they were able to, I think, send their son to Stanford and he enjoys rock climbing. So it had all these nuances that as researchers, we sometimes are not able to report on. And it just humanized some of their experiences. So it was really interesting seeing that process and how it's so different yet so complementary to what we do. And yeah, even their storytelling process, where the focus is not so much on the numbers, but the people behind them, was just really interesting.
So what are some stories, about health policies that affect immigrants? I keep saying this, but I'd like to, come back to this a lot, whether they're undocumented or not. And, one of the things I was surprised to learn in reading, one of the reports was how the unauthorized and authorized population, it's pretty 50-50, and okay, so actually I'm going to put the brakes on my question and I'm going to ask Catherine's question. And Catherine would like for you to address, how, newcomers receive news and information, and if we wanted to reach those audiences, where do we find them, and how do we find them? And this is this is a specific question about Latin American immigrants or immigrants who speak Spanish as their first language. Are they still more likely to get news and information from radio, for example? And Drishti, I don't know if that's something you all looked at in your research, and I don't know if Stella and Adriana can speak to that, but I thought I'd ask the question, and Drishti, we'll start with you.
I don't have the numbers off the top of my head, but we did ask this in our survey, and many immigrants report still receiving news in their not necessarily in English. So many still receive news in other languages. Many also receive news from different social media platforms. That was something that emerged in our focus groups as well as our surveys, is that a lot of people are even receiving their news from WhatsApp groups or groups similar to WhatsApp, but I think there's WeChat among Chinese immigrants that's really popular. So that was actually pretty surprising that a lot of immigrants now are receiving their news in general and also news on immigration policies through these social media channels, which can in some cases give rise to more confusion and misinformation. And many still listen to news in their native language.
I would like to add something.
Yes, sure. I was going to say, go ahead.
Thank you. Let's see, I think that was, I don't remember, it was June or July of this year. We did a survey, and one of the questions was that, how do you keep, where do you get your information about what's going on, right? And the top three in our case was, and I don't want to promote things, but Univision, right? Is a news channel in Spanish for the Spanish-speaking community. So that's on the TV, but the people mention also the Facebook of that news channel. Another one, which in fact that's one that we communicate a lot with our community members through WhatsApp. And that was another of the top three answers. It was WhatsApp. They get a lot of information through WhatsApp. And in our case, number three was organization like us, the post in the media about what's going on in their city, in their state. So those top three, TV news in their own language, which is American, but in Spanish channel. The other one is, Facebook and WhatsApp, and number three, directly from organizations that are in pro of the immigrant community.
Stella, I didn't know if you wanted to add to that, or share
Sure.
anything related to.
Yeah, unfortunately, I mean, I'll just say that because our coverage is primarily, well, it is exclusively in English, with the exception of, because I work in public media and my station is it's considered like a dual licensee, I think that's right, station, meaning we have the radio side and then we also have the TV side, which is PBS. And so through PBS, through our education department, my colleagues in that department work closely with the Latino community, immigrant community. I mean, basically anyone who has children, and they're really good about providing information in, at least now, in English and Spanish. I'm not sure if they're working on another language to provide information in. But on the news side, all of our content is mostly in English. I will say that some of our partner stations are other public radio stations in Texas, which, we're all sort of part of this collaboration called the Texas Newsroom. A couple of them, at least in Austin and San Antonio, they have been doing more to translate their stories in Spanish, or to Spanish. And another colleague of mine in San Antonio, he's been providing news updates in Spanish. I mean, these are like, maybe like a 5-minute type of newscast. And the same I believe in Marfa, there's a journalist who's also trying to do that. So, we haven't gotten to that point yet in Dallas or North Texas, but, I think that that's something a lot of us have pushed for, have talked about. And so I think it's really important. And even if it can only be provided like through social media, because so many people do use social media, I think that's important. I would like to see more news organizations at least try to, develop strategies that reach, their immigrant populations.
And I can't believe I hadn't mentioned this earlier, but I actually have worked for KRA on translation of English into Spanish materials very early on during COVID, information and also educational materials. I just remembered that I had worked with one of your editors or one of the engagement staffers. So we're coming up to the end of the webinar, and actually my last question, I think it'll be my last, is for Adriana. Adriana, you are you have a front row seat to how immigrants interact with the healthcare system in the US. And they may not have ever had an interaction with their own health system, the healthcare system in their country. So how do you let people know, the people that you offer services to, what kind of education do you do to educate, to just let them know what to expect? And we'll take it from there, or I'll let you answer that.
You have a very good point with that. Something that it tends to happen, at least I can talk to you about the Latin Spanish speaking countries. Usually when you want to go to the doctor, when you want to go to the dentist, you want medical assistance, you can make an appointment today and you are gonna get it maybe by Friday or maybe Monday, Tuesday of next week. So pretty quick. That's something very different here in the United States. So for example, aside that we provide information about medical topics, something that is happening depending the month, like right now, because it's coming the cold weather, or we already have the cold weather, we know the numbers of flu are going to increase. So we start to provide information over WhatsApp about get the flu vaccine, where to get it, why is the reason that it's important to get it. And every time somebody call us asking where to go, maybe they don't have health insurance, and they ask us where to go for medical services, we tell them where, but we also mention you have to call to make an appointment. That appointment is not going to be today. It's not going to be tomorrow. It's probably going to be in 2 weeks. That's how the medical services is here in the United States. So we always try to mention those tips so they are aware of what to expect.
I want to thank our panelists for making time for us today. We really appreciate it. This is an important topic. The immigrant population in the US represents 14% of the entire population in this country. And it is an important group of people that we need to keep in mind when we do our health reporting. And I want to thank everybody who tuned in today. If you joined us late, you will find the recording of the webinar at healthjournalism.org in just a few hours. And once again, thank you to the three of you for sharing your experiences and expertise. AHCJ will continue to bring you webinars on a variety of healthcare topics as a perk of your membership. So if you are listening and haven't joined today, that's something that we hope you do. And I want to remind everybody that my colleague, Mary Chris, will be she's a patient safety health beat leader, and she is hosting a Q&A on Friday, December 1st at 1 p.m. Eastern time. And it's looking at the perhaps the influence of Bill Gates on news content through the grants he makes to news organizations. And the conversation Mary Chris Jaklovic is having is with Tim Schwab, an investigative journalist who's based in Washington, D.C., who has been doing groundbreaking work about the Gates Foundation for the Nation and Columbia Journalism Review. And if you don't follow Mary Chris on Twitter, I'm still going to call it that, please do. She's great, and follow her blogs, articles on our website. And please take a moment to also follow the panelists who have joined us today. And happy holidays, everybody. And thank you again for joining us.
Thanks for having us, Margarita.